Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida in Fort Myers, Florida. I'm seeing a lot more disc replacements, and the reason that surgeons don't do as many fusions and they want to do disc replacements is they're trying to get the joint to have stability but also have motion when they believe that the problem is from severe disc degeneration. And what we're finding is, unfortunately, afterwards, after they put in the disc replacement, some of the time the area here doesn't stabilize. Like, in other words, whether this, remember when they put in the disc replacement, they have to go through different ligaments, and sometimes after the surgery, those ligaments don't tighten back up. So if you know somebody who had a disc replacement and they're not feeling that much better, they feel worse after the disc replacement, they really should come in and get a digital motion x-ray and then get prolotherapy. So imagine this person, this is the first, all they're doing is going like this. And let's see what happens. So in other words, all the person did, you saw them, it was their first pass, meaning they just went like this. So let's see what happened when they just went like this. So so when you move, the vertebrae are supposed to stay together. Well, look at this. If we go in the back of this vertebrae, they're unstable at C2, C3, they're unstable at C4, C5, they're C2, C3, C3, C4, C4, C5. Look at all that instability. Then at C5, C6, they have severe instability. So in other words, you go in the back of this vertebrae, I'm going in the back there, look at all that space. 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 So probably before, and this person didn't get this disc replacement that long ago. So probably prior to the disc replacement, they had all these instabilities, but the surgeon did surgery on one level, and honestly, that one level is horribly unstable. So this person needs, basically all the area treated with prolotherapy. But more and more, I'm finding that disc replacements, they become unstable. So prior to getting a fusion operation or disc replacement, a person really should get a second opinion by somebody like myself to assess them whether they have multiple levels of instability and whether or not prolotherapy is the best treatment option versus surgery. The thing about prolotherapy is it can address all these areas where, what are you going to get? Disc replacements and fusions, over all these areas. So definitely seek out the opinion of a prolotherapist prior to surgery. And if you know somebody who had a disc replacement and they're not doing well, it's probably this, that they have a massive amount of instability afterwards because the ligaments didn't tighten for whatever reason, or this is another interesting point, these components, these titanium or metal components, they are like magnitude stronger than the ligaments, meaning that you're going along, you're doing activities, and when the neck has to absorb the force isn't absorbed by this. These things are like 20 to 200 times stronger than the surrounding ligaments. So all the force goes to the surrounding ligaments, right? So, a disc, a normal disc is cushiony. It's cushiony, so it handles some of the force when, you're playing soccer, you're on a skidoo, you're on a roller coaster, you're wrestling around with your kids. Well, these things, they don't absorb any force, so what ends up happening is the force goes to the ligaments get injured, get lax, then you're back to having instability. So a much better option than a disc replacement is prolotherapy. Have an amazing day.